Once again, welcome to this session on Ask Me Anything with Dr. Jayanti Tumsi on breast health. Myself, I am Chinmay from Anvay Wellness. A quick intro to what we do. So we are a healthcare social enterprise focused on integrative cancer care and so we have started preventive care program for women, as well as we have a survivorship program as well as a cancer care program going on. So currently in the COVID situation, we are facilitating online consults. We are also going to start our studio as soon as this situation stabilizes. We'll have our small studio for cancer care coming up in Bangalore. So that's what we do. About Dr. Jayanti, she's an accomplished, very experienced senior breast oncologist in Bangalore, works out of Sparsh Hospital here, and she is an expert in breast oncology and breast conservation and breast reconstruction surgeries. So I'll stop sharing my screen and thank you, Dr. Jayanti, to be kind enough for joining us for this session.
Yeah. So hello everybody. Hello ladies, and great to be doing this program today. And thank you so much for logging in and showing interest in your own health. And as a woman, I feel that a woman's role in a society is so vital, and I'm speaking like a woman and also a doctor. But very often we see that women, whether educated or not, whether they're working or they're homemakers, whatever, the woman's health is certainly very low on priority. And this is low on priority. Not only, I'm not blaming the men or I'm not blaming the family, but it is low on priority for our own selves. Do you agree? I think you would agree with what I say. And I'm saying this because I have seen things going wrong for women who are educated, who have an access for all kinds of knowledge, who have access to hospitals, who have access to best of the medical facilities. Yet when it comes to their own health, there is a big gap. So I really thank Anvay and Mr. Chinmay for having this session and for initiating this beautiful thought of getting across to women while we are all locked up at home, right? So yes, he introduced me as a breast oncologist. I'm a surgeon, I do surgeries, but the idea of today's session is not to scare you about breast cancer. That is not at all the idea, but most importantly, as women, how can we look after our health is what I really think that we should discuss. All right. So I will be speaking mainly about breast cancer, early detection. How do we detect it early? What are the signs and symptoms? And how is it different from non-cancerous lumps? And please feel free to ask me questions, and I will be very happy to address all your queries. All right, so let us begin. So now breast cancer, as we know, is one of a very common cancer seen in India. All right, we all have heard, I'm sure all of you have heard, that there is a rise in the incidence of breast cancer in the world and also in India. And Bangalore is supposed to be the capital of breast cancer for whatever reason. And what is more important to understand in our country is that there are a lot of younger women who develop this disease, which is a little different from what we see in the Western countries. All right. So, don't know, few slides are not seen, Chinmay. I have no idea why, but anyway, I will go ahead. So, a lot of younger women develop this disease, and as compared to what happens in the West, in the Western countries, the incidence of breast cancer is much higher as compared to what we see in India. Yet the number of women who succumb to this disease are far less in the Western countries as compared to India. In India, out of 2 new cases of breast cancer detected, 1 woman loses her life, and that is so a matter of concern. And you know what is the difference? The difference is not that we in India do not have the best of best medical facilities. We have everything that can happen in the best center in the world happening in India. We do it in our department. So it is very easily available. Yet a lot of women succumb to this because there is lack of awareness. What is very, very shocking is that this lack of awareness is seen also in educated women. So I always feel that education and awareness are two completely different things. A woman may be educated, but is she really aware is what is the game changer, and that is what is the agenda of today's session, to give you some details about the disease, and most importantly, how by doing some simple things in our busy schedule, we can look after our own health, right? Okay. So breast cancer, luckily, is one of the few cancers when detected early and treated appropriately is completely curable. It is, if you understand this one slide, I think today's purpose is served, you know. So breast cancer is one of the few cancers when it is detected early and treated appropriately can be completely cured. So for complete cure, there are two things that have to happen. First is early detection and second is appropriate treatment. Now appropriate treatment is the doctor's job, but early detection is what all women should really understand, and that is what we are going to discuss today. All right. So let us discuss what actually happens in breast cancer. What are the signs and symptoms? Now, we all know that breast is a very superficial organ. Now, what do I mean by superficial? Breast is an organ which is just below the skin. It is very easily felt. We can easily feel with our fingers. Not like the organs like, say, uterus or pancreas, liver, lungs, heart, brain. We cannot feel with our fingers. They are deep into the cavity. But breast can easily be felt with our fingers, and hence the problems related with breast can also be very easily detected, you know. So it can easily be detected because it's a very superficial organ. Now, what is a basic function of breast? Why is it a well-developed organ in mammals, especially in women? The basic function of breast is to secrete milk and to nourish a young child, all right? So you can see here, these are the signs and symptoms. What actually happens in breast cancer? It can start as a lump. Do you understand a lump? A lump is a swelling or a protuberance or a mass, a swelling which may be seen either in the breast or in the underarm region. Now the point here to remember is that very often this lump is painless to begin with. There may be no associated pain when the lump begins, and that may be very confusing for a lot of women. They may notice a lump, but because right now it is not painful, they may not understand that it is urgent to go and see a doctor and to get the right diagnosis. So if you notice a lump either in the breast or in the underarm region, whether it is painful or painless, it is important that you go and see a doctor immediately and let the doctor decide what the diagnosis is. So it may start as a lump. Secondly, it may start as some skin changes. This skin changes, the skin over the breast or in the underarm region is normally very smooth, but this skin can change. It can seem as if it is pulled inside, what we call as puckering or dimpling. Typically what looks like an orange peel appearance. When you peel orange and you see the skin, how it is, it might look like that. It might change and look like that. Or there may be redness over the skin color may change, or there may be a very, very dry and very itchy skin, you know. So if you see any of these skin changes over the skin, over the breast or in the underarm region, yes, that could be one of the signs of breast cancer. Thirdly, the point here to remember is the nipple changes. You know, normally the nipples of the breast are pointing outwards. Now, what you need to find out whether it is pointing outwards or sometimes it can change. It can become crooked, it can become distorted, or sometimes it can actually go inside, what we call as inversion of nipple. Or there may be a wound over the nipple. Wound is a kind of ulceration over the nipple where you apply some ointments, the regular ointments, yet the wound does not heal. It is a non-healing wound. Then that could be a sign of early cancer. Or there may be some kind of discharge coming out of the nipple. Some fluid may flow out of the nipple. If some fluid flows, it's important to notice what is the color of the fluid. So if you find either a lump in the breast or in the underarm region, some skin changes over the breast or the underarm region, or if you find any nipple changes, it does not necessarily mean that it is cancer. Many times it may not be cancer. But if you find any of these symptoms, it certainly means that without wasting time, go to the doctor immediately and get yourself thoroughly examined. All right? Let's go to the next slide. Now, there are some women who are at a higher risk of developing breast cancer. Now, who are these women? Like I said before, the function of breast is to secrete milk and to nourish a child. Now, for some reason, if this function is not fulfilled, such a woman is at a higher risk of developing this disease. Now, who are these women? Women who do not breastfeed. That means women who do not get married, or who get married but do not have children, or they have children but they are not able to breastfeed for whatever reason. Such women are at a higher risk of developing breast cancer. So breastfeeding for a long time is actually protection for the mother against breast cancer. So I will always recommend women breastfeed your babies for as long as possible, at least for 1 year. Now, the second risk factor, if the first child occurs after the age of 30 years, that is again a high risk factor. Obesity, alcohol consumption, smoking are again high risk factors for breast cancer. Now, if a woman is on oral contraceptive pills or hormone replacement therapy, this is again a high risk factor. So whenever you're taking hormone related tablets, always don't just go to a pharmacy and buy it on counter. Go to a doctor, consult a doctor first, and let the doctor decide whether it is safe for you or not, and only then take these hormone related tablets. Women with family history of breast and ovarian cancer. Yes, this is the question which is very commonly asked, whether breast cancer runs in the family. Well, breast cancer does run in the family, and in most of the cases it does not run in the family. About 5 to 10% of women who develop breast cancer have a family history of breast cancer. All right, that means there is somebody in the family who had breast cancer in the past, and there is some abnormal mutated gene in their body which is being transmitted from one generation to another. That is called as hereditary breast and ovarian cancer syndrome. Yes, about 5 to 10% of breast cancer runs in the family. And that means about 90% of the women who develop breast cancer have no family history. And this is what I really like to emphasize, because a lot of women know that they have a lump in the breast, but they ignore it, thinking that nobody in my family had. So it's not possible that I can get anything like that. It is not true. Whether there is family history or not, one can develop breast cancer. Now, for some women who have a strong family history, now for those women, we can do the genetic tests now, which is a simple blood test, and we can actually determine whether there is an abnormal mutated gene which is being passed out from one family to the other, and we can actually assess the risk of developing breast cancer in that particular lady. I think we have all heard of Angelina Jolie's story, where she had a very strong family history of breast cancer. She did the genetic test, and it was determined that she herself had a very strong risk of developing the disease. And before the disease developed, she took the preventive actions, and she's doing very, very well. Now, these kind of facilities are available in India, and they are also very affordable now. It is routinely done in many, many centers in all over India. Now, there are I have emphasized on the risk factors. I've told you about the signs and symptoms of the disease. All right. Now, there has been so much. There are certain investigations that we do, which I would like to tell you about. When any woman comes to us with breast-related problems, there are certain investigations that we do to determine whether what we are dealing with is cancerous or not. Now, I'm not going to give you medical details, but I certainly want to tell you about some things, all right? So there are basically three major investigations that we do. One is ultrasound of the breast, second is mammogram, and third is breast MRI, all right? So I will give you the details which are relevant to you. So I'm sure you all have undergone ultrasound of the abdomen sometime in the past. Similarly, ultrasound of the breast is done to determine whether what we are dealing with is a solid lump or is it filled with water. All right. But the most important investigation as far as breast-related problems are concerned is a mammogram. All right. Now, mammogram is a special kind of X-ray we do of the breast. All right. Now, this is an investigation which is very good for women who are 40 years and above. Now, what is a mammogram? Mammogram is basically an X-ray of the breast where the breast is placed between two plates of X-ray, and very, very low dose radiation is used. And by doing mammogram, we can actually study the internal architecture of the breast. Now, why is mammogram important? A mammogram can detect an abnormality in the breast when it is so small, when it is so tiny. It may be few millimeters that it is not even felt. Are you understanding what I'm saying? Now, for a lump to be felt in the breast, either by the woman herself or by the doctor, the lump has to be big enough to be felt. Now, before it becomes big enough, it can be detected on mammogram. Okay, so before it becomes felt, clinically felt, it can be detected on mammogram, and mammogram has actually saved many, many lives. All right. So I would recommend that all women who are 40 years and above should undergo a mammogram test once in a year. However, mammogram has its own limitations because it is not a very good investigation for women who are younger, who are less than 40 years of age. It may not be the best of the investigation. So all women 40 years and above, we would certainly recommend that you get a mammogram done once in a year. Now, there are so many advanced treatments available, different kinds of treatments are available. I'm sure you've all heard of surgery, chemotherapy, radiation therapy, hormone therapy, and now immunotherapy, etc., etc. But I would just like to tell you in short that there is a lot of advancement that has happened generally in the field of oncology and especially in breast oncology. Now, there is one fear in women's mind, which I've seen in my experience, that a woman feels that if I develop breast cancer, that means my breast will be removed and the femininity or the womanhood is lost, you know. So friends, that is not the case anymore. There are many, many advanced surgeries now where without removing the whole breast, only the abnormality is removed and the cancer can be cleared very well. So not only is cancer cleared, but also a good cosmetic outcome is now possible for women. So women need not fear, especially when I said in India, a lot of younger women develop this disease. You know, the cosmetic part also becomes extremely important because it's an emotional issue. So that can also be taken care of. All right. So we have been talking about breast lumps all this while. Are all the breast lump cancerous? No, not at all. In fact, 80% of the problems that happen in the breast are not cancerous. It is only 20% that could be cancerous. And let us now understand what do we need to do for that 20%? How do we detect it early? All right. Now, I hope you understand that early detection is the game changer. Breast cancer, if detected early and treated properly, can be completely cured. In India, a lot of women succumb to the disease because they do not detect it early because of lack of awareness, all right? Now, how to detect it early, I am going to tell you shortly, all right? So I hope you understand that early detection and appropriate treatment are the only two things which can save lives, all right? So early detection is the game changer. And now let us discuss how to detect the disease early, all right? Now, to detect the disease early, there are three things basically we need to do. These three things together are called breast screening. First is breast self-examination, where all women can examine their breast themselves. You know, all of you should examine your breast yourself. How to do, I will shortly tell you. Clinical breast examination, when you go to a doctor and the doctor examines you, and mammogram, we've already spoken about mammogram, which is an X-ray we do of the breast for women who are 40 years and above once in a year, all right? Now, talking about breast self-examination, friends, please listen to this carefully. This is extremely important part of today's session. Now, breast self-examination, like the name suggests, you need to examine your breast yourself. The recommendation is that all women who are 20 years and above do a breast self-examination once in a month, all right? All that you have to do is spare time once in a month, and all that it takes is less than 5 minutes, you know. So all you have to just spare less than 5 minutes in the entire month, and that can help you very much in the long run, all right? So breast examination, all women 20 years and above once in a month, all right? Now, when do you do it, all right? Ideally, it is done on 7th day of the periods. Now, if you get your periods today, it is day 1. So 7th day of the periods is when it is the best time to do the breast self-examination. Now, why 7th day? Because during the periods or just before the periods, I'm sure you'll agree that breast is very tender. It is very painful. It in fact engorges. It becomes bigger in size. It becomes very nodular. So I don't recommend that you do it at that time. 7th day of the periods is the ideal time. However, there are women who do not have regular periods. They have irregular periods. Or there are women who have undergone menopause. Menopause means as a woman ages, her periods stop. Or there are some women who have undergone hysterectomy. That means their uterus has been removed for some other reason. Obviously, they do not get their periods and they can't do on the 7th day of the periods, but they need to do it also monthly on one particular date in the month. All right. So all women, either 7th day of the periods or one particular date of the month, all women 20 years and above, once in a month, please do breast self-examination. All right. And whatever we are discussing today about breast self-examination, please talk about it to other women in your life. You know, you can teach breast self-examination to anybody. You don't have to be a doctor to teach breast self-examination. All right. So all women 20 years and above, 7th day of the periods or one particular date of the month need to do a breast self-examination. All right. So what do you actually do in breast self-examination? It is looking and feeling. All right. How do you do it? By standing in front of the mirror and in lying down position. All right. Now let me show you pictorially how to do it. All right. So please pay attention. This is step number 1. I'll show you stepwise how to do this. And this is exactly what you have to do in your house. All right. Once in a month. All right. So stand in front of the mirror like this lady is standing with your bare body. Keep both the hands on the hips. Look into the mirror and observe both the breasts. Look into the mirror, observe both the breast, observe the size and shape of the breast. It is possible that one breast is a little bigger than other. A little difference in size is acceptable and it is normal. If there is too much difference, yes, you need to see a doctor. Now, when you look into the mirror, observe whether you feel any lump, whether you feel any irregularity of the surface, or whether you feel there is any swelling, all right? Observe the skin over the breast, all right? The skin over the breast is normally very smooth. Does it seem as if it is pulled inside? Is there any color change in it? Or does the skin appear extremely dry is what you need to observe. Now, third thing that you need to observe is observe both the nipples. Normally, the nipples are pointing outwards. Is there any change? Has it become crooked? Has the shape changed? Is it gone inside? Is what you need to observe. All right. So this was step number 1. Now going to next step. This is step number 2. You still need to stand in front of the mirror. The only change now is you have raised both the arms. All right. Now, why do you need to raise both the arms? Because the underarm region, or what we call as the armpit, is also part of the breast. In fact, a part of the breast extends into the underarm region. So observe both the underarm region in the mirror. Look for any swelling, any kind of irregularity, or any skin changes in the underarm region. All right, so this is step number 2. Now going to the next step. In the third step, on the 7th day of the periods or any particular date of the month, when you are taking shower with soap on the body, it is a good idea to quickly feel your breast. All right, while you're taking bath, when there is soap on the body, quickly feel your breast. Now why? Because when there is soap on the body and you're feeling the breast, even the small lumps can easily slip through your fingers because there is soap on the body. All right, so it's a good idea to quickly feel your breast while you're taking a shower with soap on the body once in a month. All right, going to step number 4. This is in lying down position, and you can see on the screen, this is exactly what you have to do. She's in lying down position. There is a pillow kept below the shoulder. That's what you have to do. Keep a pillow below the shoulder and the hand has gone behind the head. All right. Now to examine your right breast, use the left hand. To examine your left breast, use the right hand. All right. So this is the position that you have to be in, and feel the breast. Now when you're feeling the breast, it's important that you feel with flat of the fingers. All right. Do not use the thumb when you're feeling the breast. All right. Do not feel the breast like this. Do not use the thumb. Use only flat of the 3 fingers. If you use the thumb, even the normal breast feels like a lump. All right. So just feel it with flat of the 3 fingers. All right. It's important that you feel the entire breast and not miss out any single part of the breast without feeling. All right. This is very, very important, especially for women who have had children, and as you age, after breastfeeding, the breast starts sagging down, right? And in some women, the breast may become very, very big in size. So it is possible that while you're feeling it, you have missed out one part. So that you do not miss out on any part of the breast, you need to examine the breast in a very, very systematic fashion, all right? So how do you do it? You use either one of these methods, all right? Let me show you the middle method. This is very simple and I would recommend that you do it. This is called as a concentric circle method. When you're feeling the breast, start feeling around the nipple with flat of the fingers like this. You can see here like this. Start feeling around the nipple with flat of the fingers. Keep feeling whether there is any lump. Then make bigger circles going in a circular fashion. Then make still bigger circles all the time, feeling with the flat of the fingers, and then still bigger circle so that the entire breast is covered. Okay, I hope you have understood what I'm saying. Whatever I've explained today is nothing new. It is all there online. You have to just click one button and all the information will be available. All right, you can just go to YouTube and click breast self-examination. Lot of videos will come up and you can understand what I'm trying to tell you once you see the video again. All right. So once you examine one side of the breast, the same thing has to be repeated on the other side of the breast. All right. So when you're doing breast self-examination, you're basically looking for any lump in the breast or in the underarm region, any skin changes over the breast or over the underarm region, or any nipple changes. Now, when you're doing breast self-examination every month, all right, the idea is you get familiar with your breast. Now, when you do a breast self-examination month after month, month after month, month after month, on the same day of the month, you become very familiar with the look and feel of your breast. You will exactly know what is normal for you. And then in the future, if something develops, you will easily detect it. You will know that this was not there in the past. I'm finding something new now. And that is when you need to go to a doctor immediately and get yourself examined. So when you're doing breast self-examination, if you find a lump or if you find skin changes or if you find nipple changes, does that mean it is cancer? Well, it may not be or it may be. In fact, 80% of the times it is not cancer. So when you're doing a breast self-examination, if you find something, do not panic. But at the same time, without wasting time, go to the doctor, let the doctor examine you, do the necessary investigations, and then decide whether it is cancerous or not. All right. All of this we are doing because it's important that we detect the disease at an early stage. Smaller the size of the tumor, when we detect it and treat it, better is the outcome. When the size of the tumor becomes bigger, the outcome becomes poorer. All right. So the smaller size is better when we start the treatment. Okay. So there have been many studies which have shown that by doing breast self-examination and clinical breast examination, a lot of women's lives have been saved. All right. Now the problem in breast cancer, like I told before, is that the lump may be painless to begin with. There may be no pain associated. So unless you bother to put your finger and feel your breast, you will not even know that there is something growing in your breast, because it is not painful. We have seen a lot of women coming with huge lumps, 6 centimeters, 7 centimeters lump, but they never had pain. So they did not even know that there was a tumor growing inside the breast till it became very, very big and it became very obvious. Obviously we don't want to wait for that stage. It is best to detect it when it is small in size. And breast self-examination is so doable. It is so easy to do. You don't even have to travel anywhere. You can just do it in your house, in your own private space. All right. So friends, it's important, like I said, the size of the tumor at the time of the diagnosis is very important. So it's important that we diagnose the disease when it is of the size of a green pea or a groundnut. Don't wait for the size of the lump to become a size of a walnut, and certainly you don't want to wait till it becomes size of a lemon. Okay, smaller the tumor at the time of treatment, better is the outcome. All right. Like I said, if it is small in size, we do not have to remove the whole breast. We can remove only the lump, so the remaining of the breast, which is normal, can be conserved. We can do a breast conservation surgery. And if the disease is very, very early, chemotherapy may not be needed, So the treatment becomes simpler. We can do breast conservation surgery. The treatment becomes shorter. It becomes cheaper. And most importantly, outcomes can be very, very good, because breast cancer, when detected early and treated properly, can be completely cured. All right. And no woman should lose out this opportunity of complete cure just because of lack of awareness. All right. So please do breast self-examination regularly. It is so simple and so doable, and be aware of your breast. All right. So these are the early detection guidelines, my friends. All right. All women 20 years and above need to do breast self-examination once in a month. Women who are 20 to 40 years of age, along with breast self-examination, once in 3 years, go to a doctor and get a clinical breast examination done. Let the doctor examine you once in 3 years. However, for all women who are 40 years and above, breast self-examination should be done once in a month. Along with that, once in a year, get a mammogram done. All right. Now, mammogram is available in most of the major hospitals. All right. As a part of the routine health checkup, all women 40 years and above, please get a mammogram done. All right. So certain risk reduction tips: maintaining healthy body weight is very important. Like I said, obesity is one of the very high risk factors. All right. Exercising regularly is important. Now, maintaining body weight and exercising regularly, I have kept as two different points. And why I'm saying this is because you might have an ideal body weight. You may be very slim. You may not be obese, but that does not mean that you don't need to exercise. All right. Even such women need to exercise. And also there are some women who are obese and they feel that how much ever I exercise, I do not lose weight. All right. So do not worry about losing weight. Yes, it is ideal to have healthy body weight, but doing exercise regularly, whether you're obese or not, whether that helps you reduce weight or not, being physically active is extremely important. Having exercise regime of 5 to 6 hours in a week is very important. A simple walking, brisk walking for 1 hour every day will help in the long run. Eat as natural food as possible with lot of fruits and vegetables. Do not use the ready-to-eat food, the fast food. You know, there are food that is available now. You just get it from the market, put it in the microwave and it's ready to eat. You know, do not indulge in that as much as possible. Eat natural food, eat a lot of fruits and vegetables in your diet, limit alcohol, stop smoking, and certainly breastfeed your babies for at least 1 year. Please go ahead and ask questions and I will be very, very happy to answer.